The fact that we as a society have terms like birth rape and obstetric violence means that something has to change. Recently, I reached out to a doula page and asked for them to share with me stories of violence that was done to them or their clients. I'm going to read for you some of the things that were submitted. Be quiet. Stop screaming. Stop crying. It doesn't hurt that bad. Don't be a hero. There's no way you can do this without an epidural if you already think it's bad. You're doing it wrong. You can't push until the doctor gets here. If you don't get Pitocin, you're going to get an infection just like the lady next door, and she's about to die. You need to make up your mind if you're going to get an epidural. I'll do it now, but I'm not coming back. You can't sit like that. I don't care if it makes it more comfortable. Labor isn't about comfort. You can either let me check you, or you can just lay there in pain until you decide I can check you so I can find out if you're allowed to push. Things like birth plans prevent me from doing my job. Stop pushing. There's no way you're ready yet. You're not really in labor. Actually, I was 7 centimeters dilated. Why don't you just take the drugs? Why are you punishing yourself? Why are you even trying to do this naturally? All of those things were said by doctors and nurses to women giving birth. Another doula submitted a similar question to a doula page I follow. She asked, "Is this real? Is birth rape real? Has anyone experienced this?" She got 172 responses. I heard a story of a woman who informed the nurse that she was a sexual assault survivor and asked when she did the cervical check to be gentle. The nurse replied, "Well, you handled sex, so I think you can handle this." I have personal experience with a client who was a recovering drug addict. During her labor, she didn't want to have any medication because she did not want to hinder her recovery. Her recovery meant everything to her. Her recovery meant everything to her child. During labor, the OB mocked and teased her for choosing to not have drugs. He said, "Why don't you take the drugs? Why are you punishing yourself?" The hashtag is Consent Protector. I encourage you to request your care provider or your client's care provider for a picture and post it with the hashtag Consent Protector. The purpose of this hashtag is to build up, encourage, and praise the care providers who are supporting their patients in ways that encourage informed consent and in ways that fight obstetric violence. I believe that one of the ways to make the world a better place is to build up those who are the helpers, who are the servants, and who are the protectors.